We're going to talk about adolescent development. We have about 3 or 4 things we need to get done. First of all, we really need to evaluate the particular specific developmental task for kids between the ages of 12 and, we're going to say 19, but God only knows when it ends, okay? So we're going to talk about that. We're going to break it down into 3 specific phases. We're going to talk about early, middle, and late adolescence. And we need to do that because I think, unfortunately, what we do is we tend to lump teenagers together. We tend to say teenage offenders, teenage substance abusers, kind of put them all in a group or put them all in a program, and then have expectations across the board. And I think probably we gear most of our interventions for 16-year-olds. If we're doing really good adolescent work, sometimes I still think we gear our interventions for 25-year-olds. But if we're a really good adolescent program, we tend to gear our interventions for like the middle adolescent type of client. And what happens is then we leave behind particularly the really young kids. And we're going to talk a lot about young adolescents for a variety of reasons. One is we're seeing more and more of them. And they're kind of a mystery to us because their developmental phases are different. They're there's some things going on with them that make them very unique creatures. We're going to talk about them. We're also going to talk about, just in general, when kids are done with the process, what it is they need to have accomplished along the way. We're going to talk about what happens when kids along the way end up using substances. How does substance abuse in particular affect their adolescent development? I really think that when we work with kids, we ought to, before we do anything else, figure out where these kids are at developmentally. It doesn't really matter chronologically where the kids are at. It matters developmentally where they're at. Because you can have a 17-year-old child chronologically who functions like a 12-year-old. And if your expectations of that kid from a treatment perspective is that that kid performs tasks that a 17-year-old should be able to perform, you don't get anywhere. And you know that you're stuck developmentally with kids if you're over here and you just keep saying, come on, let's go. You're not with me here. What you have to do with kids who are developmentally delayed is, number 1, recognize it. And number 2, you have to go back, you have to hold their hand, and you have to move them forward. There's absolutely no substitute for time in terms of maturity with kids. There's no substitute whatsoever. Now, we're lucky that adolescents can catch up in the maturity process rather quickly when they're clean and sober, when they're in a healthy environment, but nonetheless, they need the time. And I also think that we make a mistake because in the substance abuse field, I've always heard this. Well, as soon as the kid starts using, they stop maturing. So that means that they started using when they were 12, they must be functioning like they're 12-year-olds. That's not necessarily true. That we don't know where that child was functioning when they started using. And that they are not always in the same level of development in every single phase of their life. Cognitively, perhaps, the child is quite sophisticated, but socially quite immature. So you may have a very sophisticated 16-year-old on your hand who started using when they were 13, who's real bright, and whose level of functioning, cognitively was pretty mature, but socially we're never there. So what does that mean? I mean, I never know what that means when people say, well, they must be 12 because they started using when they were 12. No, because we don't know where this child was developmentally when they stopped using. So what we have to do, I think, to be really good in working with kids is to stop and say, let's take a look here at what this child ought to be able to do. Let's take a look at what they're capable of doing. Let's gear our treatment interventions accordingly. And what we know generally is our kids tend to be really immature in terms of their development in all phases of their life versus mature. So we end up treating many 16 and 17-year-olds who very much function like they're 13-year-olds. And are probably going to do that until they grow up. And I kind of tell people, if you've got a 17-year-old who functions like he's 13, the best thing for us to do is to go back and set a treatment goal as if he's 13 and a half. Okay? And when he's, and when he does that, we say, oh boy, we got 6 months here. This is good. You can't take a kid who functions like he's 13 and set a 17-year-old treatment goal because we don't get anywhere. They cannot do it. They're not going to accomplish it. We're going to get angry. They're going to get frustrated. And frustrated kids act out. And frustrated kids act out. This much we know about kids. So the first thing I want to talk about is just what kids need to do in the process of adolescence. And this is what the research tells us, and we're so lucky because of this. It says that the onset of adolescence is happening early and earlier. Attitudes, behaviors, and maturation physically are kicking in at about 11 to 12. And the completion of adolescence is happening later and later. We used to pretty safely say by the time 18, kids have completed most of these tasks. We now have another phase of development called young adulthood, which is between the ages of 18 and 25. And what we're seeing is we're seeing that those last phases of development with kids are not being completed until they're well into their 20s, which means the phase of life that our society hates the most is been expanded by about 6 or 7 years. Okay? And if you have kids at home, I hate to be the one to break the news to you, but they're going to be there for a while longer. longer. And we see it consistently. I mean, we see it with research that says the number of kids who do not go to college, or the number of kids who go and can't function once they get there, just because developmentally kids are, even the kids who are like the high-functioning kids who are not necessarily the kids in placement or in treatment anywhere, developmentally are very far behind, which is a real crisis for us, because if that's what we're seeing, we really need to understand, then we need to look at that from a perspective of intervention with them. So kind of an interesting piece of development here, unfortunately for us, that the adolescence is extending way into what we used to consider young adulthood. So let's talk about the things that our kids need to get done so that they can successfully finish this developmental phase of life. And the first thing that they need to do is separation and individuation. Those are two very painful processes, not so much for the adolescent, but very much for people around the adolescent. And they go hand in hand. And first of all, they have to go through a separation process so they can individuate and find themselves, which basically means this. They pull away from us, the adult culture. They separate from us, they separate from their families, they separate from just kind of the adult culture itself, so that they can develop themselves as people. Only when they've done that are they able to come back and reconnect with us. Now, what we need to try and do for them during that process is make sure that they continue to have some ties to the larger world. And what we end up having with kids in the 90s is kids who, in that separation, individuation process, sever their ties with us, with their families, with their communities, with their schools, and they don't come back and join us. We have a real problem with losing kids during this phase. But they have to do one before they can do the other. They have to separate. They have to establish themselves as individual little creatures who know what they think and know what they believe, then they can come back and join us. And that's really what that process is like, where they pull away and come back. And they pull away at the age of 12, and they come back when they're done, whatever that might be. Some of them never come back. But hopefully they come back when they're done. Psychosexual development, two things that the kids really need to do. Number one, they need to be in touch with just their whole physical maturation. They need to be in touch with their sexuality. They need to understand what's happening to them. They need to understand that process and what it means in relating to other people, and develop a level of comfort with that. It's a very new experience. It's something that's very different for kids. And we always forget why our kids, especially young adolescents. I do a group of 14-year-old kids and boys, and they just talk about sex all the time. Drives me crazy. Why? Because sex is new to them. And because they're so narcissistic, they think that no one else knows about it, that they are the generation that discovered it. They're totally obsessed with that whole sexual development, because it's a new experience for them. It's very intriguing to them. So they have to understand all that comes with that. Very big challenge for kids who are substance abusers, and we'll talk about that. This is a huge challenge for them, both males and females. And along with the psychosexual together, psychosocial, those two things go together. They really need to understand what are they in terms of other people, what are their obligations, how do they fit into the culture, how do they develop friendships, how do they learn to understand interaction. So psychosexual, psychosocial development. A sense of meaning and purpose. Some reason that I'm here, something I have to offer, some commitment that I can make, some purpose that I can have. Kids in the 90s, they don't have this one. When you ask the kid at the end of the week, did you do anything this week that mattered, that counted, that made a difference anywhere? And they look at you and they say, I never thought about that before. Am I supposed to be doing that? Yes. You're supposed to be doing that. In a culture that doesn't think kids have anything to offer, it's kind of hard for kids to find a sense of meaning and purpose. Years ago, generations ago, teenagers had very specific roles to play. They had very important roles to play in their family. We needed them. We needed them to help with families, to help with the farms, to help with labor. They grew up with a sense of meaning and purpose in that adolescent transition. When kids don't have that, they're lost. And they seek that, and they seek that in places that get them in trouble, as we all know. Social competence. Kids need to be able to develop social skills so they know how the rules work. They know how to start conversations with people they don't know. They know how to maintain conversation. They know how to judge what is appropriate behavior in what type of situation. And they need to develop some sense of confidence in themselves socially. Some sense of confidence in themselves socially. It's a very painful, painful process. It's excruciatingly painful for them in early adolescence. If they struggle through that as opposed to avoid it and escape it, they come out of the other end of that feeling much more comfortable socially. Once again, a problem for substance abusing kids, and we'll talk about that as we continue. Cognitive and language development, that we start and finish the process of abstract thinking skills, and we're able also in that time frame to develop language that can express what we're thinking and feeling. Huge part of their development. The part of their development that you can't necessarily see when you're watching them, that you can only get it by listening to them and talking to them. So very critical piece of their development, cognitive and language skill development. We need to really think about what the research is telling us, that we really thought historically that kids who are 17 or 18 were really done cognitively. The time you're 17, 18, 19, you're as cognitively mature as you're ever going to be. The only difference in us and them was our life experience. The research says that's no longer true. That we know that kids mature cognitively well into their early 20s. And in fact, some research with college seniors indicates that they cannot generalize information, which means they can use information that they're taught in their particular field of study, and they can use it very well. But when you ask them to take those same concepts and apply them outside their field of study, they don't understand. They're not able to do that. So we really need to understand that when we work with kids and we expect them to do very mature cognitive things like generalizing information, taking information from one environment and placing it in the other, it's probably a task that if you don't break it down in real concrete steps, they're not going to be able to do it. I don't know if anybody can do it. Because when I train, I always think people can take the information and apply it. And I always hear this, that won't work on my kids because they're too young, they're too old, they're too poor, they're too rich, they're too spoiled, they're too deprived, they're too urban, they're too rural. They don't have court involvement, they do have court involvement. They're not court ordered, they are court ordered. I think it's all the same reasons like this material won't work with these kids. This doesn't apply to my kids because when you take material like general adolescent development, you have to be able to generalize it to the kids that you work with. And you know, it's pretty generalizable. So I think that we expect kids to do that. It's a very hard cognitive thing to do, even for adults. Very hard for everyone to do. Let's move into early adolescence. We have here that we're going to start with the age of 12. Very often, particularly with girls, this early adolescent developmental process starts earlier, 11, sometimes 10, but we know that when we're dealing with girls, the process very often starts early. So early adolescence, really talking about the age of 12 to 14, huge transition. To live in the body of a 12 to 14-year-old child and to have all these changes occurring inside, and they all kind of wreak chaos with your internal world, it's a difficult thing. It's really the change from childhood into adulthood. And there are several things that change. And the first thing, and probably one of the most important, is that whole concept of cognitive development. And kids are really beginning to make that transition from thinking very concretely to be able to think abstractly. Just beginning to make it. And I think we need to understand that they have periods of abstract brilliance followed by periods of concrete thinking. And it's confusing to us that they can think kind of abstractly in some particular areas, and then we just want to, just like they're as dumb as a box of rocks in another. How can that be? Well, they're just really starting that process. And there are many things that go with that process that explain their attitudes and their behaviors. And in particular with young adolescents, we need to look at whether or not this is really a behavior problem or resistance. Very much early adolescence, number one, we can diagnose them with everything there is to diagnose them with because they show all kinds of symptomology. The other is that we could probably lock them up because they make us crazy. With the way they fluctuate in their emotions and their feelings. And they don't understand very often a lot of what we're trying to teach them, although they act like they understand a lot of what we're trying to teach them. So that whole cognitive process of early adolescent development is very important. What does that mean? What does that mean when they go to being, from being concrete to abstract things? It means several things, and one is that they've never thought this way before. Now, why do young adolescents think that we're stupid? Okay. Because, see, they can think abstractly. And 6 months ago, they couldn't think abstractly. And they're like, whoa, look at me now. I'm thinking about this stuff. I've got this under control. And they're thinking, you know, and they don't think that you know how to think that way. They think it's a secret. I know how to think this way, but you don't. And so when they say, you know, have you ever had that experience? You're trying to explain something to them. It makes perfect sense to you, and they're looking at you like, you don't know who you're talking to. I am a genius. I've got this figured out. Because they've never been able to think this way before. It's a cool way to think. You know, abstract thinking is kind of a neat thing to be able to do. So they're able to do it, and they're like, oh. And they think they're the only ones that can do it. It's a secret. Boy, I know something that nobody else in the whole world knows. I had two girls, I was laughing. They were both 14-year-olds, and they're smoking a lot of pot. And they go, pot helps me think better. And I go, explain what you're talking about. So they explain the process of abstract. You wouldn't believe the things I'm thinking about. It's just incredible, the things I'm thinking about. And I said, yeah, it's called cognitive development. It happens to everybody. What? Everybody can think this way? Oh, yeah. You too? Uh-huh. I don't believe you. So she went home, told her friend called me. Is that true? Because she and her friend had like developed this alliance where they were talking on the phone till wee hours of the morning, exchanging abstract concepts. And they really, really had convinced one another that no one else in the world was going through this cognitive process. And that's why they think we're stupid, because see, they don't know that we've been thinking this way for a long time. So it's really hard because they're just so powerful. Oh, whoa, that was a good thought. Boy, look at me. Particularly since they couldn't think that way a very short period of time ago. And then they get very insulted when we start treating them like they don't know what they're doing, because inside what it feels like is I'm powerful. From a cognitive point of view, I'm really powerful. And all the things that go with, that. One of the things that go with that with these kids is that it's kind of the emergence of independent and critical thinking. Kind of for the first time in their life, they've really been able to look at things and evaluate things and think about things in a critical, what they consider to be a very adult fashion. So what that means, this is what critical thinking skills, this is what it sounds like to you and me. How come? Who said? Well, that's stupid. You know, and little things like, I remember working in a residential program, have the kids mop the floors. Why do we have to mop the floors this way? This is stupid. Whoever thought of, and you're like, I don't care, just mop the stupid floors. Well, I've got a much better way to mop the floors. So they question constantly. Who said, how come, this is stupid, who made this rule? And it's very irritating. And we can label it as resistance if we want, but it's just like anything else. When they're trying to master a new skill, they do it to the point that it annoys everybody around them. They always do that when they're 2 and they do a new skill. You know, when they play peekaboo forever, it's like, enough of that already. You know, never play peekaboo with a baby on a plane. It's like, okay, go away, go to sleep. I don't want to play anymore. It's like anything else. They want to do it until they've mastered it, so they do it to a point of just annoying everyone around them. So that is what critical thinking skills, independent thinking, I can have a thought about this, you know, and believe me, I have one about just about everything you're going to ask me to do. And because that's new to them, they love doing that. It looks like resistance. It's annoying to deal with. Nonetheless, it's a very normal process in the thinking. They ought to be able to just start to grasp abstract concepts and words. And we really need to understand that they start to grasp those. But they like to talk like they have a grasp of those. And the way they talk like they have a grasp of those is they love to use abstract words to explain concrete situations. They don't understand, and they'll use things, and sometimes we overreact to them because they use things in a very abstract fashion that just explain a very concrete, specific thing that happened. And if you take that too seriously, or if you put too much stock in it, you'll be very concerned about them. And a very simple thing that they use all the time is they love you one minute and they hate you the next minute. Well, we know that's not possible. How can they love you one minute and hate you the next? How can they think you're great and then, you know, and think you're terrible? Well, because things like love and hate are pretty abstract, and they have a lot of depth to their meanings. But what they do is they love you when you do something nice and they hate you when you make them mad. Those are very concrete kind of situations. So they tend to love to throw around abstract words, abstract phrases that sound very adult that they really don't have very much of an understanding of the true meaning of. And we kind of make that worse sometimes because we like for them to talk treatment jargon, therapy jargon, and use adult words. And the scariest early adolescent in the world is one who's been in therapy a lot. Because they start throwing this around, you're like, I hope you don't talk that way at McDonald's. You're never going to get a date if you talk like that. Please, you know, just talk like a normal person. So they latch on to those kind of abstract-sounding types of things that they think sound mature, and they use them, and they don't know what they mean. Sometimes they don't have a clue what it is they mean. They ought to be able to move into a period cognitively at this point where they really kind of start to develop a little more sophisticated, problem-solving skills based on kind of logic, based on reason, those types of things. Thinking deductively. And I used to, there used to be a typo in this handout. It said thinking deceptively, and I almost left it because it's about the same difference, you know. But what happens particularly with adolescent girls is adolescent girls, cognitively, they kind of kick in to their ability to think and figure things out and figure out how people are going to respond to them, and they learn to manipulate. And they learn that it's so much easier to get your way through manipulation than it is doing head-on battle with people very often. So they do that, and that's just because their thinking skills sometimes are very sophisticated and very often ahead of the males in their age group. And so they use those skills, and girls don't tend to like conflict as much, so they have a lot of different ways that they use to get their needs met, and very often it's through, you know, really kind of depending on their ability to think abstractively, think deceptively, think deductively. And I really think that kids like to manipulate at this point because it occurred to them they can do it. It's like, you know, if I really think this through, if I really evaluate how people are going to react, I can do this and this and this and get this outcome. It's kind of an abstract thinking kind of cognitive game to them. The second piece of their development that I think is the ignored realm of development with kids is the whole concept of language skill development. As kids are moving into a place in their life where they're thinking and feeling very abstractly, very differently than they've ever felt before, they now have to come up with the words that express those thoughts and those emotions. We make some real serious assumptions that kids' cognitive abilities and their verbal abilities always mature at the same rate. In my experience, particularly with adolescent males, there's almost always a time in their adolescent development where their cognitive skills and their language skills are not on par with one another. And it's a very, very frustrating time in their lives for them. So they're big. Okay, they grow, you know, their bodies have changed, they look mature, sometimes they can say very mature things, but a lot of times they just can't verbalize what's going on with them. And that's because language skill and cognitive skills do not always fit, number one. And number two, if you think about what a different language skill it requires to express yourself abstractly as opposed to concretely, and explain your real intense feelings versus childish feelings, requires a whole different vocabulary. It's very difficult. Kids struggle with that. And if all we ever want them to do is to talk to us about how they feel, we're setting them up for failure because that's very hard for them. Developmentally, that's hard for them, whether they're kids with problems or kids without problems. That is something that they struggle with. And my best example that I love to use this example, I've used it a million times, was I used to love to watch that show, The Wonder Years. And I loved it because it was a really good depiction of what the internal world of an adolescent was like. And the main character in that show, he went into 9th grade, and he was 14. And he just had a horrible day. And all through the first day of school, in 9th grade, the first day of high school, in the back of his mind was this voice, and it kept saying, oh, it's a terrible day. I'm just having a terrible day. I can't wait to see Winnie. That was his girlfriend, you know, and tell her and pour my heart out to her and tell her what a terrible day. She'll totally understand it. I can't wait to see her. So at the end of the day, he goes to this hamburger joint. He sees his girlfriend. She goes, hi, Kevin. How was your day? And he goes, fine. And the voice in the back of his head said, sometimes when you're 14, life is difficult to put into words. Sometimes when you're 14, life is difficult to put into words. And I remember that when I get like 89 calls on my answer machine before the kid ever makes it to my office, and everybody's complaining about what they did, and you know, in school and at home and in gym and on the bus and all that stuff. And they come in, and I go, how was your day? And they go, fine. And I know it wasn't fine. I know that we've had problems all day because I've been getting messages on my machine about this kid all day long. So, and when the kids say fine, sometimes it's like, I don't even know how to start to tell you what has happened to me. I don't even know how to explain to you why this stuff has happened to me. I don't know how to tell you how I feel about this. Language skill development, very critical. And if their development's going very smoothly, it matches their cognitive development, but that doesn't always happen. If it happens, that's fine. The kid can express themselves. We don't have a problem. But when they don't match, that's when we start to have problems. And what we're looking for in that early phase of development is that they should be able to really increase their ability to write and speak in kind of the same way that they're thinking. But I really think this is something that takes 2 or 3 years for them in early adolescence to really kind of get a good handle on. The other thing about young adolescents is they're much more likely to express themselves with their bodies versus their words. If you look at all the research, for example, on when violence in schools peak, it's in middle school. Middle school kids fight all the time, constantly. Now, it's not okay that middle school kids fight, but it's not as near as much of a problem when a 13-year-old strikes out as it is when a 17-year-old strikes out. That they just tend to, there's a really strange connection between their body movement and their mouths. And I always tell people, if you can't get a young kid to talk, get his body moving and his mouth will follow. You know, shoot some hoops with a walk around the building with him, let him do something with his hands, and he will start talking to you. But I think it's very awkward for young adolescents to sit down, be still, look at you, and have a conversation about their feelings. I just think that's a very awkward. Young adolescents don't do that with anybody. They don't do it with their parents. They don't do it with their friends. They don't even do it on the telephone. They do, you know, I don't know, they talk on the phone. They got 39 other things going while they're talking on the telephone. So it's very awkward for them, and it's much more comfortable for them to use their bodies. When you have a group of young adolescents, particularly young adolescent males, and you're doing a group setting with them, and they're in a good mood and they like everybody, what are they always doing to everybody else in their group? Drives us crazy. They're touching them. They're constantly poking them and hitting them, messing with their hair and untying their shoes. Drives us crazy. We call it horseplay. We don't like it. We make rules against it. Well, you know, that's what young adolescents do. I can't stand it because they're always like patting me on the head. Your hair's all poofy, you know, or I'll be talking and they'll reach over, I have my legs crossed, they'll grab my foot. Are you listening? It's like, get away from me. You know, we have Nerf bats in our playroom. They'll put the Nerf bat. They'll be tapping me on the knee with a Nerf bat. Janice, it's like, put that thing down. You know, and that's how they affection. That's how they show their affection. That's how they communicate. That's what they're comfortable doing, is they have a real hard time that when they want to communicate with you, they think they got to be touching you. Okay? Usually in an annoying fashion. Very normal. Use their bodies. When they're upset, when they don't know how to express what's going on with them, take defensive stands, push, shove, slap. They tend to do that. We need to understand that's part of their communication pattern. Now, we have to put limits on that. But we need to understand that they also need some places to do that. They need some outlets for that. We need to not make that a huge, big pathological problem, because it isn't. It's how they communicate. It's what they're comfortable with.